through that process. And what I would say, if you've got a high number of staff who aren't willing to be vaccinated, because we know peer pressure and, you know, just that general and peer support, equally peer support can help you get all your staff vaccinated if the majority are going through that and you're leading well, and other people within the organisation are happy to advocate for that. But we also know that peer pressure can also send it the other way. If you've got somebody who is particularly against, then other people start to listen to them as well. So if you have those scenarios and you need that support on a sort of more of a one-to-one basis to try and address those concerns, will you please let the COVID team know, and we will do whatever we can to support what those particular concerns are. Rachel, do you want to talk about some of the resources that we've got available from ACAS and such?
Yes, and I was also just going to say people need to also consider about recruitment of staff. And the time frame from, obviously, if you are recruiting staff and they're non-vaccinated, they need to get themselves vaccinated, and then it's a 3-week period, isn't it?
That's what we're expecting. Yes. So if you're recruiting someone, they've only got to have had it's 3 weeks after their first vaccination. And that they
as a condition of their employment, they agree to actually continue the vaccination programme, and so they'd have the second dose. And then if it becomes a requirement that they need to all have boosters as well, that they would actually have the booster vaccination. Unless, of course, something horrendous happened after the first vaccination and they were medically exempt from the second. So both Skills for Care and ACAS have actually got some really good resources to support employers around the kind of HR aspects of this. So thinking about updating policies and procedures, thinking about updating recruitment procedures as well, and checks for your actual service. They've also got, ACAS particularly, I've got some really good resources around that kind of supporting people through informing them of the change, then actually having one-to-one conversations, then actually starting to saying, well, this is going to go, you know, to you being dismissed. And it is dismissal, it wouldn't be redundancy. So they would not be eligible for redundancy pay or anything like that. It is a mandated condition of employment. So they would really need to seriously think about that if they're going to be dismissed as a result of them not actually having the vaccination. So in terms of ongoing support from government or, benefits, their class has been dismissed. So, that needs to be a consideration. So as I say, ACAS have got some really good resources, and we've put together a little resource sheet for you. Some of the resources listed on that sheet were really aimed at care homes. However, the actual, employment law, etc., it's the same. So I'm sure ACAS, Skills for Care, etc., Public Health will all be updating resources for this sort of second rollout, and they'll be done quite imminently. But we still haven't had the actual formal guidance from the government, although it is perhaps coming today or tomorrow, I believe.
They might be signed off. That doesn't mean to say we'll get the guidance.
No. Yeah, that could be a while. So there's a question there about if staff are dismissed, are they still entitled to work their notice period? So
you would send them or give them notice of dismissal, that it would allow for that notice period to say, so effectively, if on the 5th of February, that person has not had their vaccine, then at that stage, you would serve them notice to say, as of the 31st of March, you will no longer be employed by this company, you'll be dismissed. So it would give them an 8-week notice effectively at that stage if they haven't undertaken their first at that stage. And likewise, there'll be something similar for the second vaccine as well. So, but there will be more guidance, and I'm sure there'll be lots of webinars that will come up with a bit more detailed information about this as soon as everybody has the details.
Absolutely, I know there will. I know that organisations like Skills for Care will be quickly on it, as will ACAS. And, you know, with ACAS, you can actually ring them for advice. It's a free service. So, you know, do make use of them. They are really good. And it may be possible that we actually was it called Rich Jones came to one of the Registered Manager Network meetings a while ago. But I mean, he may come and be willing to actually do a short presentation for us all, actually to take you step by step through the process, and certainly get in touch with him. Yeah. And see if he'd be happy to do that.
So the next 3 weeks really is all about focusing on trying to support people to get that vaccination. And that's certainly how care homes approached it. It was very much, let's just focus on trying to make sure everybody crosses that threshold and gets over that threshold, and focus the conversations on that. Then when we get towards the, you know, up and coming date of the 3rd, and the people are unlikely to be getting their vaccinations. And I have to say, in the care home, we had people who did it literally on the last day. There were so many people who did it on the last day. And left it to the last moment. So you might find that with a number of people, and potentially with the second vaccine. So just, you know, be aware of that. And then after that, we can then spend your time focusing on how you serve the relevant notice, because most people will be on a maximum of 4 weeks notice. So you've got time within there to send the letters, have the proper discussions, and follow due process around that as well. So much information on the provider zone available to people. There is the resource pack that's just been produced. It'll be updated on a regular basis with all the latest guidance and templates, etc. We will send out as soon as any webinars are organised around sort of the HR side of things, because other organisations, well, Skills for Care quite often organise different things like that. So we'll make sure we send those out and get those out to people. Gavin, did you want to come in?
Yeah, just picking up a question in the chat which said about booking boosters at Jacobs Well, Airedale, or any of the vaccination sites. There's a link there that Ben's put in the chat. Alternatively, just Google COVID vaccinations and you'll be able to go through to the NHS website that books it in. That's probably the best thing to do, as opposed to calling 119, because they'll just refer you directly to that website anyway. As is put in there are walk-in centres that are around if people just do want to pop in, and that information is available on that webpage that Ben's put in the chat. But if you want to book an appointment, just Google COVID vaccinations, you'll go through to what's called the National Booking Service.
Yeah, and if you have any difficulty, or as we said, if there are a large number of staff that you would like support with, for whatever reason, if there's a particular hesitancy that a number of your staff are sort of discussing, please let us know, and we will look to either get you tailored resources that can come out to you. We'll look at a pop-up if appropriate, and we'll we can invite other providers to attend that as well. Ben, did you want to come in?
Yeah, I just, as always, just want to offer the COVID-19 support teams help in anything. So when the guidance does finally come out and you're reading through it and you've got a couple of questions, or if there's something that's a little bit of a grey area or anything like that, please email the team and we'll put our heads together in order to get a response out, or at least we will ask the people that need to give the steer for the district in order to get a response back to you about what we'll be doing in Bradford. So if there are any questions once the guidance comes out, please feel free to email us and we'll do our best to provide an answer.
Thanks, Ben. Tracy.
Just to say that not all the PCN sites will be on those bookings as well. So some of your local GPs will be offering those as well. So if you hear about them, most of them would be happy to vaccinate people are not registered there as well. So it's just that most of them are not on the sites. There's only a couple of them that are actually on the walk-in sites and availability. But if you have any particular problems, and we know there's a GP surgery near that's offering clinics, then we could also do that as well. That might be a link. It may be that there's a surgery nearer that might be easier for people to access.
Brilliant. Thanks, Tracy. Rachel?
It was just really to remind people, like my managers, that the WhatsApp group, if you're not on it, it's a really excellent support network. The manager will ask a question and usually you'll get 3 or 4, often more responses people have either experienced it, they've got a good idea, or they've got a clear understanding of something that isn't made, is like as clear as mud to you at the moment because you've read 3,000 documents that day. So the WhatsApp group is really, really good. And Meg manages it, doesn't she, Louise, from the BCA? So you can just, email admin at the Bradford Care Association, and Meg will add you, your manager or deputy. Please feel free. It's a fantastic support network.
Yeah, definitely. Any questions, anything that happens, struggling to get hold of lateral flow test, whatever it might be, it's there as an option. So please make sure that you utilize that, because it is really, really helpful. And just remind, it is never too late for anybody to get any vaccination at this stage. Flu, whether it's COVID, the two can be given at the same time. They can be given a day apart, a week apart. It doesn't really matter. It is there, available through a variety of channels. If you can't access it or you're struggling, please just let us know. But it's never too late. And if you have any staff who right at the last minute or have buried their head in the sand, and we did see this, and on the 10th of February suddenly decide, actually I now don't want to lose my job, then they won't be able to work for that period from the 1st of April till the point when they can have their second vaccine. But, maybe they can look at annual leave, unpaid leave and different things like that, or, looking at catching up on their training at that point in time for that week, etc., while they can't work. So, there's some of the other things that people did to support people who weren't able to get quite through the vaccination in time. But as I say, I suspect there will be some kind of temporary exemption for those that have a delay because of caught COVID over these last few weeks, and then unable to get their vaccine as planned, or as they would have intended to do so. But we'll have to wait and find out a bit more information on that. We'll still again wait and find out about the new recruits, full details about how you recruit new people, and that after their first vaccination they'll be able to work after 3 weeks. So as soon as they have a successful interview, at the same time as sending off their DBS, send them for a vaccine if they're not already vaccinated, and probably by the time the DBS etc. comes through and they've completed their training, they'll be ready to start in work. And that will apply to care homes as well. We hope that will apply to care homes as soon as legislation comes in, rather than having to wait till the 1st of April. But again, we're just waiting for more information on that as to whether that will be the case or not. And a reminder about your infection control fund, that is there to support you in managing these vaccines, in trying to support staff to get these vaccines, in transportation, their time in order to get the vaccine, and all those different things as well. That is there to support you in doing that. So please utilise that fund there. There is also the workforce grant as well, don't forget, about recruiting and retaining. And given that actually a condition of recruitment and retaining staff will be that they have to be vaccinated, then it could also be deemed as a thank you for actually taking the time and taking that leap to get vaccinated, that you are giving a retention bonus to those staff who have been stayed with you, worked with you through what has been a really challenging time, particularly over the last few weeks and months, and over the next few weeks and months. But also, as it can be indicated as a thank you for taking your vaccine at the same time as well, because it will be a condition of retaining their job in the first instance, or recruiting. So have a look at how you utilise that and how you word that to staff. Because again, it could be another asset to say, as a thank you for doing this and getting your vaccine and being fully vaccinated and staying with us over the last 3 months. There's the workforce grant that's being paid to you, which the initial amount for the first part I think was £145 for the first element, and the second element is £300. And obviously that they could be used to be paid as bonuses or etc. As well. So have a look at that and see how you can utilise that. Just as a reminder as well, while we've got you, it's just around. I hope everybody received the email about the SUS and the service update system, or whichever system service update, whichever way around it goes. That has been reinstated for you to flag whether you're red, amber, or green if you're having any challenges around staffing, accessing lateral flow tests, PCR tests, whatever that might be. We are aware, obviously, that home care providers are unable to order lateral flow tests like care homes are, and therefore you're having to go through the same route as the public in order to access those. So we're in the process of trying to arrange a central stock of those so that when home care providers aren't able to get them, to enable your staff to continue to work, then you'll be able to pick them up from a central store. So we are working on that at present, because we know that people are going through lateral flow tests at a rate of knots, and likewise with PCRs. So please just let us know, make sure you're using the SUS and updating and flagging. That will be monitored out of hours as well, and over weekends. And don't forget the IPC team, Darren and Michael are there to support as well, with anything, and the WhatsApp group. Ben, did you want to come in then?
Yeah, I was just going to say we do actually have a central stock now through the COVID hub. It'll be managed through the COVID-19 support team. So if you get in contact with us, we'll be able to support. Unfortunately, because they need to supply a large amount of people with the lateral flow, we might not be able to meet your specific orders, but we'll at least manage to get enough for your staff to be tested. I just want to put that caveat on there, because we have been told that some providers have been ordering a large amount, but we can't do that up front. So you'd have to probably collect it and then again collect it again in the next week or the next 2 weeks, for example. We won't be able to front you for a month like you could on the national portal.
Yeah, no, and just say, so there is a sort of a process of rationalisation and prioritisation for lateral flow tests at this moment in time because of the challenge in accessing them. And obviously we know that PCR tests are a bit of a challenge to get hold of as well at times. So at the moment you can still access those through the national booking system, which it can be a bit of a challenge at times. But if you do keep going, it does refresh. Centenary Square do offer walk-ins as well, where you don't actually need to have an appointment, so you can just walk in there, but can't guarantee necessary availability. And we are also looking at some provision at both BRI and Airedale for any critical staff. Again, that'll be managed through the COVID team. So we've got availability there for needing that rapid sort of access to PCR and test results as well. So please let us know on that. Brilliant. So yeah, Centenaries, they are bookings, but you can actually there is the option to just walk in as well. They do have walk-in facilities available, but you can't guarantee, if you go down there is a chance they could be out that, but they do have walk-in clinics. We are trying to secure a bit of a priority access for care workers and health and care workers at the moment at Centenary Square, but that hasn't been done as yet. But you can, there is the option for walk-in at Centenary Square for that. And that's for PCR, that's for PCRs, but obviously just in terms of vaccinations, there are a number of walk-in clinics for those all over, which are listed on that page as well. Well, thank you very much. I hope you've all found this useful. We can organise another if we need to. Reminder, we've got provider update next Tuesday at 10:30 on the same link. We'll put a reminder in the WhatsApp group, so we'll just update you on all things where we're at and where you can access different things and guidance, etc. So please attend that. It's for the whole sector. Appreciate sometimes care homes can dominate with the challenges that they have, but it is for the whole sector. So please, feel free to join and attend that. And if you've got any questions, the COVID team are there. We're here. Use the WhatsApp group. And yeah, please get in touch and we will share this recording and all the resources through the bulletin and such at the end. So thank you for everybody for attending.